Which dental implant should you choose, and why is the price difference so massive across the globe? Today, we are diving deep into the world of dental implantology to save you thousands of dollars and potentially months of pain. If you think all dental implants are the same because they are just titanium screws, you're about to make a very expensive mistake. We are comparing the industry titans like Straumann and Nobel Biocare against affordable alternatives and explaining why a clinic in Beverly Hills charges $5,000 while a clinic in Dubai or Tokyo might charge half for the exact same part. By the end of this video, you will know exactly which brand fits your jawbone and your budget. When we talk about the best dental implants in 2025, the conversation always starts with Swiss and Swedish engineering. Straumann and Nobel Biocare hold over 60% of the premium market share. But what are you actually paying for? Is it just the brand name, like buying an iPhone, or is there a biological advantage? The secret lies in the surface technology. Straumann uses a patented surface called SL Active. This is not just a marketing term. This technology reduces the healing time from months to weeks by attracting blood cells to the implant surface almost instantly. This process is called osseointegration, and it is the single most important factor in whether your implant fails or lasts for the rest of your life. Now let us look at the materials. Most people believe titanium is the only option. However, grade 5 titanium alloy is the industry standard for a reason. It is biocompatible and incredibly strong. But for patients with metal sensitivities or those who want the highest aesthetic result in the smile line, zirconia implants are becoming the new gold standard in the United States and Canada. Zirconia is a ceramic material that is 100% metal-free and has a white color, which means you will never see a gray shadow near your gum line. But be careful because zirconia can be more brittle than titanium, and not every surgeon has the expertise to install them correctly. Before we get into the specific cost breakdown between different countries, I have a quick request for you. If you find this technical breakdown helpful, please subscribe to the channel and hit the notification bell. We spend dozens of hours researching medical data to bring you this information. Also, I want to hear from you in the comments. Have you ever received a quote for dental implants that shocked you? Share your story or tell us which country you are considering for your procedure. Your experience helps our entire community. And please share this video with a friend who is currently struggling with dental bills. It might save them a fortune. Back to the global economy of a smile. Why does the same Straumann Roxolid implant cost $5,000 in New York and only $1,500 in an elite clinic in Dubai or Poland? First, we must understand the overhead costs. In the United States and Canada, a dentist carries a massive burden of student debt and malpractice insurance. This insurance protects you, but it adds a premium to every single tooth. In contrast, clinics in the United Arab Emirates or Japan often operate with lower tax brackets and different insurance structures. Furthermore, the cost of the dental laboratory where your crown is made varies wildly. A digital workflow using AI and CAD/CAM technology in a high-tech Dubai lab can produce a crown in 1 hour at a fraction of the cost of a traditional manual lab in London or Toronto. Another massive trend in 2025 is the all-on-4 or all-on-6 protocol. This is for patients who are missing all of their teeth. Instead of 20 different implants, a surgeon places 4 or 6 high-quality Nobel Biocare implants at specific angles to support an entire bridge. This is a game changer for the industry, but it is also where most complications happen. Choosing a cheap implant for an all-on-4 procedure is extremely risky. If one implant fails, the entire bridge fails. This is why premium brands like Straumann offer a lifetime global guarantee. If you get your implant in Tokyo and it has an issue while you are in Chicago, any certified Straumann provider will recognize the warranty. That peace of mind is part of the high price tag in North America. When choosing your implant brand, you also need to ask about the abutment. Many clinics try to save money by using a genuine implant but a generic third-party abutment. This can lead to microgaps where bacteria grow, causing bone loss and implantitis. Always insist on original components. Whether you choose Hyosyn from Korea, which is an excellent mid-range option, or the premium BioHorizons, which is famous for tissue attachment, make sure your surgeon provides you with the implant passport. This document contains the serial number and the exact model of what is inside your body. To summarize, your choice should be based on 3 things: your bone density, the location of the tooth, and your long-term health goals. If you are replacing a molar where chewing force is high, go for titanium. If you're replacing a front tooth and have thin gums, consider zirconia. If you are doing a full mouth reconstruction, do not cut corners on the brand. Stick with the big 3: Straumann, Nobel Biocare, or Zimmer Biomet. While the upfront cost in the USA and Canada is high, you are paying for a regulated system and a surgeon who has invested $500,000 in their expertise. However, if you choose the path of dental tourism, ensure the clinic uses the exact same digital protocols we discussed today. Thank you for watching, and we will see you in the next deep dive into medical technology. This video is for educational purposes only and does not replace professional medical advice. Always consult a licensed dental professional.